A nurse does stuff like talk to the patients, and spend more time with the patients than the doctor does.
I think a nurse aids you when you're in need.
A nurse basically, well, it depends on which nurse.
A nurse looks after people.
They put people to sleep. They give them anesthesia for surgeries.
A nurse helps out people.
Helps people. Instructs you more like a teacher. And just is there.
Assisting the surgeon during surgery. There's people who just gives them shots and watches over them. There's people who work with people who have mental illnesses. And that's just what nurses, basically different nurses do. They just take care of their patients.
A nurse is a person that goes around and helps sick people, makes them happy when they're sad or scared. Is basically there for comfort and then also helps them in the medical ways that they need to be helped.
Them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones, them bones, them dry bones, gonna hear the word of the Lord. Them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones, them bones, them dry bones, gonna hear the word of the Lord.
Well, your leg connected to your knee bone and your knee connected to your thigh bone and the thigh connected to your hip bones on here. The word of the Lord.
Them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones, them bones, them dry bones, gonna hear the word of the Lord. Them bones, them bones, them dry bones, them bones, them bones, them dry bones, them bones.
Camp Bones is back and energized with a new group of 8th and 9th graders eager to learn about medicine and nursing careers.
Camp Bones, Brigade of Nurse Exploring Seahawks. When we were talking about what to name this Nurse Academy camp, one of my most valued faculty, Dr. Ruth Ann Kuiper, came up with that name. We were talking about bones and we were looking for something that would be snappy, and we had several options, but that was the one that everybody was just gravitated toward. So it was a good choice.
Let's check out our returning students to see how things have progressed.
Today's activity is called Beating Hearts. And what everyone is doing is they're going around and they're taking their heart rates while they sit, while they walk, while they jog, and then they'll take it again while they sit.
Last year we interacted with the School of Nursing and the hospital, but this year we did the question why in coastal rehab and the cardiovascular rehab center, and it was really fun.
It's different this year because we got to do different things and different workshops. Like the other night we did a seminar with Question Why, and they were teaching us things about tobacco.
Although we learned a lot too, the discussion helped us remember it.
What excites me about nursing is the fact that we get to help people and give back to the community. That just what makes me feel a lot better about myself, makes me more confident.
We welcome you to the closing ceremony for the 2006 Camp Bones students.
Stopped short from the door. He got up and started walking.
Yeah.
That was very inspiring.
It was like in a sudden death match where you had all the participants in Camp Bones, our heart rate and our blood pressure.
There you were born.
The new students are introduced to a few of the many possible careers nursing brings to them.
Nothing against anybody else, especially nursing. I have the greatest job in all of nursing.
Someone tries to get help for problems instead of using drugs.
A nurse can do anything. It can be from helping children to helping like senior citizens or anybody. You can help anybody. You can do anything. You can work in community, hospitals, homes. You can be with people that's pregnant. You can do anything. You can be a psychiatrist, anything. So that's why I want to be a nurse, because you can do anything you want.
So diverse, you can find what fits you. And there's a lot out there. Air and ground transport. And that's really what makes the difference. You have to have a nurse on board to be a critical care transport.
And we learn about respiratory, percussion, not like the Jones percussion, but like how to monitor your breathing and stuff. That's mostly it.
That you can go to. Yes. A lot of ways to go. Go one way.
These are diesels, and these things can go like 300,000 miles. Unfortunately, it seems like it happens more totally unexpected on a non-critical care run than it does on the critical care.
Where you're driving down the road doing CPR.
What excites me the most is I didn't really even know there was so much different kind of nurses, and when I heard all the different ones today, they actually sounded pretty good. But I did find my favorite one was, I think it was the psychiatric, I think it's called.
My heart.
I can hear my heart.
My chest was a little pressure.
At UNC Wilmington, the students learn about anatomy and physiology with actual hands-on experience. They also learn about growth and development, nutrition, and risk factors for chronic illnesses.
Make sure you put on your glove.
In case it gets too serious, I'm going to offer everybody. Don't get scared.
Okay.
Students are taught by healthcare professionals. Everyone takes classes in CPR and first aid, essential skills for anyone entering the healthcare profession.
There you go.
And Caitlin, I always tell people to listen underneath the shirt.
Oh my, Lila.
Go get social services.
Oh my God.
Nurse, go get social services.
You got the
Okay.
As you can imagine, and as you hear every day on television, and anywhere actually, there is a growing health shortage, and depending on who you talk to, there is a shortage of healthcare workers in just about every field. You make healthcare workers by making healthcare educators. There's also a huge shortage of educators. You can do all you want about trying to recruit folks into professions, but if there's no one to teach them, then you don't really create them. So the concept here is to begin exposing folks really early. There are many times that you can look at sometimes even a young child, but certainly someone who is in their high school or in their middle school training, and identify them not only as folks who may have tendencies toward healthcare careers, but are students that can be trained and interested if you get them interested very early on in their career. It's been shown many times that they continue with that interest and actually do end up entering the field. So if you will, we're sort of cultivating the field and looking ahead way beyond the usual, which people think about college graduate, high school graduates. These kind of programs actually go a couple of steps before that, and they work very well.
The 6 to the 7 to the 8 to the 9:30. Come back up. Let's give 2 more breaths. That was 17 seconds. Oh, baby, you're gonna survive this. You will survive. Now let me see you get in the right place. Oh, that's good. I'm glad to hear that. But you gotta get to a 4 because this man is going to die. Did you name your mannequins? No.
It has to pass through a valve. And this valve is called your pulmonary, again, pulmonary meaning dealing with the lungs, your pulmonary semi-lunar valve, to all the way down to the apex. So you're going to make one big incision all the way down to the apex. Now, this is really thick muscle, and it's hard to, like once you open it, it's really hard to keep it pulled apart. So what I suggest that you do is make your cut and then make another cut right next to it so that you can cut out like
You're gonna make some stupid for rice tonight.
No, you're not. That's not beef.
Congratulations.
The count I bought was nasty at first, but I got used to it, and the pig heart, it was.
All right.
There's gotta be some way you can cook that.
I won't be eating it.
It's probably
like some pork chop.
Blood from. This is your uncut heart, cut across the pulmonary trunk and down the right ventricle.
You can clearly see it. Look at the arteries.
I learned how the heart works and how it's similar to a human. And that's why they use like the pig's heart and the cow's eyes.
I've always wanted to be a nurse or go into the medical field ever since I was really little, when I had to go to the hospital a lot with my grandfather being sick, and I always got to see the nurses help him out, so I always wanted to do something like that.
A new addition to UNCW's youngest class is forensic nursing.
So do twin brothers or twin sisters have the same fingerprints?
That's a very good question. And you know what? No, they don't. The cool thing though about people who try and be slick like that and wear gloves, we also can process and pull off shoe prints. A lot of times during a B&E, breaking and entering.
Probably about 9 or 10, I decided that's what I was going to do. That he had a firearm and he shot you. One, it's conspiracy to defraud the government, which you would both get into trouble for.
This year is just as much fun as last year, but we are able to build upon the experience of what we've learned from last year so that we can take our simulations and we can make them better. When we were discussing all of the different roles about nursing, I feel like I have the best job in nursing because I get to work with nursing students, I get to work with the campers, I work with the faculty, I work with the administration. We're planning our new building, and I really have a good time working with the campers, and I also enjoy working with the interesting mannequins that we've got and showing off our lab and showing what we have to offer in order to improve the teaching for our nursing students.
Do we want his arms like that if he's turning? No. No. That, we're going to keep that on because we're a little bit concerned about Mr. Simeon. We'll monitor him. We want him to take, all right, I want you to reach over towards the side rail, okay? Reach. As he's reaching, his body's going to go over, right? Ew. What happened? This was under him. That was under him. Oh, well, that could cause pain. A continent of stool, okay? So are we going to let him sit there? No. We need to change him. All right, so who wants to help change him? Me. All right, Mr. Simet. Okay, we've got some gloves.
Students meet some very interesting people while at Camp Bones. These people have a heartbeat, a blood pressure, and other vital signs. They can go through labor and even voice how they are feeling. Of course, they aren't real people. Most nursing students in the world don't have the opportunity to work with this cutting-edge technology.
30 cc's in, and this is the bolus. You let it flow in by gravity.
The thing I've seen as of recently was this little girl. She was like 4 months old, and when the student didn't point it out to me, but when you're assessing, if you look at everything, you should be seeing this.
Anything below your waist is considered contaminated. Anything behind your back is considered contaminated. So you keep them above your waist and in front of you so you can see them at all times. And no sneezing. No sneezing. Okay,
Now we're doing a doctor's doing an operation and he sneezes.
That's very bad. Because there's strep and staph bacteria inside of his nose, and he has sneezed onto the sterile field. They would very likely start the whole surgery over again.
Just the fact that, like, if I'm giving a guy a tool and let's say I give him the wrong one or something, like, that person could die. I mean, it's like their life is like sort of in your hands as well as the doctor's.
This is saline that they put in if they were going to put it in somebody's, it says 9.9% sodium chloride. So that's the compatible fluid for everything that we put into people's bodies.
So it has electrolytes in it, like salts and things like that.
Yeah. Salt is compatible with the same amount of salt that's in your blood.
What's the problem?
One's big and one's small.
One's little then, so she is not Perla, okay? So she has one dilated pupil.
They put their legs down.
No, we need their legs up there. So you go ahead and put her legs back in the stirrups.
These things stink.
Okay.
That's a key. So would you wrap it in?
We would have cut that, but we can't cut this cord, so we kind of leave it.
So would you wrap it?
We want to wrap it up. Where do we give shots to a newborn?
In the foot.
In the foot? Well, we take blood from the foot.
New Hanover Regional Medical Center hosts a special class in psychiatric nursing and self-defense.
Find your, first just watch, and then we'll do it again, and you guys can do it with your partner. Karen's got a hold of my arm, but she's a strange person, and I don't know her, and I'm not going anywhere with her. I'm going to make a fist, because that's going to firm up all of the muscles in my arm. The thumb is the weakest joint in the hand. So what I'm going to do is, when I make this fist, I'm going to go across her thumb joint.
Did you do it, Virgie? Yeah, I got out.
Camp Bones is a tremendous opportunity for New Hanover Regional Medical Center to reach out to the next generation of nurses. As we all know that there's a critical nursing shortage across the country, and the next generation will face even a higher shortage of nurses than the current one does. And this is an opportunity for us to reach out and show that next generation of nurses exactly what goes on inside a hospital, to give them some real world experience. There's a lot they can learn inside the classroom, but there's even more they can experience on the different floors working with people who are in nursing today. So Camp Bones really provides that opportunity for youngsters who have said they might want to look into nursing or healthcare as a profession, gets them into the hospital. They learn in the classroom, and then we bring them in here and work with the people who get people better every day.
During the second week of Camp Bones, students shadow nursing professionals at New Hanover Regional Medical Center.
The students were so engaged that the faculty was surprised at the level of engagement of 8th and 9th grade students. So what I see is we're going to have some new Seahawks on our hands in a few years, and they're going to be very, very engaged and smart students. Well prepared for college, by the way.
We're bringing nursing back. What?
The most exciting part of camp is just like being able to learn all the different types of things about nursing while having fun at the same time.
And since I want a career, a medical career, I decided to come to Camp Bones.
Helping out people, like treating them, helping them out with any kind of sickness or stuff like that, because I just love helping out people.
I went to the pediatrician when I was getting my checkup, and she was so nice, and I like the stuff that they do. They deal with children. I love children.
Working with the Sims has been my favorite thing.
I want to be a nurse.
Either to become a midwife or a neonatologist. It deals with premature babies, and I love babies.
I want to become an anesthesiologist.
And I want to become a doctor, an OBGYN.
I would rather be an OBGYN or a radiologist.
I want to be a neurosurgeon.
Yeah, I really want to work in the ER because it's a fast-paced thing, and I tend to get bored really easily, so you never know what's going to walk into the ER, so it's going to be really fun. Yeah, I'll be into blood and goods.
And then I'm not really a fan of adults. And I don't really like little kids. I love little kids, but I mean, all little kids aren't good. Some are bad, and I don't want to have to deal with.
I still want to be maybe a pediatric or maternity nurse, but I think I might try to look into rehabilitation nurse.
So I always thought babies, because babies just make me go, ah, and they smell so good, and I don't know, I think I would be leaning more towards maternity nurse.
Yeah. There will be mountains that I will have to climb, and there will be battles that I will have to fight. But victory or defeat, it's up to me to decide. But how can I expect to win if I never try? Oh, I just can't give up now.
Here it is. So you think you can sing.
I've gone too far from where I started from. Nobody told me that the road would be easy, and I don't believe he brought me this far.
American Idol.
I expect to learn a lot more of the profession I want to be in and just have a great time.